So we know that despite all of our attempted advances to make fistulas, that dialysis catheters are actually used in 80% of all patients who start hemodialysis and 20% of even those who've been on dialysis for a long, long time. And just imagine you've got this hanging out of your chest and what is essentially a piece of artificial material sitting in your heart. That is just not a natural way to live. It creates tremendous inflammation that has consequences on patients' cardiovascular system, and it has a tremendous impact on the infection. In fact, despite being a necessary evil, dialysis catheters confer a 91% increased chance of infection in any given year compared to fistulas. That's where our device comes in very, very handy. It's a very simple, unique extension of a regular cap that fits into the hub of a dialysis catheter that can reduce microbial growth by 100,000-fold. In addition to affecting the health of our patients and loved ones, catheter infection and associated cardiovascular disease carry a huge economic burden. We spend 7% of the Medicare budget on just 0.2% of our country's population. Catheter infection alone costs $2 billion per year. But if they're not going away anytime soon, how can we help this dire situation? That's where Nitrocap Medical comes to the rescue. Our device is a cap for the dialysis catheter that elutes nitric oxide. Nitric oxide is a very special molecule. First of all, it's an endogenous molecule. That means that it's not made by man and is non-toxic in the appropriate doses. And it functions in our body to vasodilate, to communicate between cells, to decrease inflammation, and to fight infection. Now, the problem is that it's a very unstable molecule, and no one has been able to harness its very impressive power in the body until now. We have devised a way to contain nitric oxide in a stable donor molecule that elutes NO over a period of 3 days, in which we put into a disposable catheter cap that's exchanged at each dialysis session. Nitric oxide is produced as a gas. It never enters the body, and it disinfects the inside and outside of the catheter as it diffuses harmlessly into the air. As a nephrologist and interventional specialist who exchanges catheters for our patients every day, I am very pleased to offer such a powerful and easy-to-use solution. The Nitrocap fits on the hub of a tunnel dialysis catheter exactly as a regular cap would in between dialysis treatments. But that's where the similarities end. Unlike a regular cap, the Nitrocap provides a chemical barrier to bacterial entry and growth within the catheter. When we first made the Nitrocap, we knew it would be effective, but we couldn't imagine how effective it turned out to be. When we did the animal study, it turned out that the Nitrocap reduced bacterial growth in the catheter by 100,000-fold compared to a regular cap that's used in 95% of dialysis sessions. What you see on your screen is a chart that represents bacteria count over time. On the x-axis is days, on the y-axis is the cell count, but it's in a log format. And what we compare is our device in the blue versus a regular control cap in the yellow. And as you can see, that as time goes on, 100,000-fold more bacteria grows in the catheter with a regular cap compared to a catheter with our device. When we first performed the original study, we were surprised by how effective the Nitrocap was, but we didn't know at that time where the effect was taking place. We assumed it was only at the hub of the catheter. So we performed a second study, the results of which you see in a chart on your screen. We homogenized different parts of the catheter from the hub to the tip. And surprisingly, we discovered that there's a 10,000-fold average reduction even at the tip of the catheter in bacterial growth. Perhaps more exciting, the nitric oxide released by the cap resulted in far less biofilm in the catheter, which you see at the bottom of the chart. We're very excited about this result because biofilm allows bacteria to hide from the immune system and even from antibiotic therapy. We were even more surprised when we repeated the experiments and found that the growth of bacteria and biofilm was reduced, not just at the catheter hub, as you can see on the bottom left, but even as far as the tip of the catheter on the bottom right. We believe that Nitrocap can revolutionize the care of our dialysis patients. but it isn't exclusive to dialysis in the longer term. We're confident that it can function as a platform technology for the care of hem-onc patients, for those having a PIC for infection. We think that the platform technology will revolutionize the care of all indwelling IVs over time. Now, this can result in a $2 billion savings to our society in dialysis alone. However, anyone who has family or patients who suffer from the life-disruptive problems associated with catheter infection, this effect will be priceless. Both within dialysis and more broadly, the Nitrocap represents an attractive market opportunity. The University of Michigan has filed for patent, and Nitrocap Medical has licensed the patent. We've discussed the potential impact and opportunity with large dialysis organizations and have received overwhelmingly positive feedback. We plan to pursue a 510(k) submission based on a predicate device and anticipate FDA approval in 2022. We intend to pursue an indication of antimicrobial effect initially. We plan to bring the Nitrocap to dialysis units in 2022 and subsequently perform a post-approval study to determine the effect of the Nitrocap's antimicrobial effect on reduction of infection. We are currently in discussions with manufacturing companies to mass produce the Nitrocap. Nitrocap Medical anticipates from the dialysis market alone an annual revenue of $78 million. The only competition currently available on the market is a chlorhexidine-based catheter cap. We compared our device with the competition and found that in animal studies, Nitrocap confers a 10,000-fold reduction in bacterial growth. Our team consists of doctors, engineers, scientists, and business people who've spent a combined 100 years in their respective fields. We are serial entrepreneurs with a track record of healthcare innovation and success, both at the startup and the big company level. We're committed to raising the required funding and executing the development of the device to bring it to the clinical arena as quickly and efficiently as possible so that we can help our patients. At Nitrocap, we're in the process of raising $5 million to bring us to commercialization within 2 years. This money will be used to create an automated facility for development of the device, pay salaries, navigate the regulatory process, and very expediently bring this technology to the bedside for our dialysis patients. We think that this device can have a huge impact on our patients' lives. Our patients are constantly living in fear of catheter infection and catheter dysfunction. If you think about it, they're on dialysis for 3 hours or 4 hours, 3 times a week, and they feel wiped out the rest of the time. Imagine trying to go into this scenario thinking, I wonder if my catheter is going to work. I wonder if I'm going to have to go have surgery on it. This is a very difficult situation. And for this reason, we think that our device, which can decrease microbial growth by 100,000-fold over a regular cap, can impact patients' lives directly. Finally, we'd like to thank ASN, HHS, and the greater dialysis community for supporting our innovation. Thank you.